This is Gene Krebs.
Hi there. Oh. Whoop. Whoosh.
And we're high on Ohio.
Our group was founded in 2003, but it came about because of some heavy lifting and thinking that occurred in 2002.
Okay.
A group of mental health providers came together in 2002 and really began to have a discussion about how they weren't able to advocate the way they wanted to. And I've said to folks, it's no surprise. I mean, when could they do it? You know, in the middle of the night. I mean, they're running big agencies serving people with some really deep end needs. So they weren't able to advocate the way they wanted to. So they came together to talk about that and create a new model for how to engage in advocacy. And it's that model that we've had the pleasure and the honor to be able to move forward through the years. And that model is one where we bring together diverse stakeholders from around the communities. So it's not just the behavioral health organizations and the boards that are advocating on behalf of mental health and addiction disorders. Rather, it's hospitals and courts and the faith-based community and others out in the community that serve folks but may not provide behavioral health services. All of these entities and the people that work there see the impact of untreated behavioral health disorders every day. When I say behavioral health, it's mental health and addiction disorders. So they see the impact, whether it's in their emergency rooms, in their courtrooms, whether it's in their pews on the weekends, whether it's in their classrooms with kids failing, whatever the case may be. They all see the impact, and they have now all come together and they advocate on behalf of behavioral health. 2/3 of Ohio's population have somehow been impacted by a mental illness or an addiction disorder. Bobby and Betty Buckeye also pay for it when we have kids that don't access the behavioral health services they need in school or while they're school age, and they drop out. Bobby and Betty also pay for it in regard to people that don't have adequate housing situations, and they pay for it in homeless services. There's a whole host of ways that Bobby and Betty are paying for it in the state of Ohio, even if they don't have a personal connection. Let's be penny wise and not pound foolish, is something that we talk about a lot. And it resonates with folks on both sides of the aisle. Mental health and addiction disorders, I'm so happy to report, receives bipartisan support. There is a growing recognition.
This is a driver.
For a couple of reasons. I think people are becoming more comfortable talking about the fact that either they or someone they know has a mental illness or addiction disorder. We're talking more about opiate addiction than we ever did because it's in our face. I think we're going to continue down that road as well. There has been through the years this misguided notion and this stigma that people with a mental illness are violent. They are scary, scary people, will snap, will hurt you, will engage in violent activity, and we know that's not true. I would have to say it's a deep concern about people that don't have around them the supports that they need to thrive, achieve their full potential, or in some cases, Gene, even survive. And of that group, I worry particularly about kids. And of kids, I worry particularly about minority children. And of that group, I worry about minority males. We need to adequately support behavioral health services in the state, mental health services and addiction services. We need to do it fiscally, through financial support for those services. We need to support them through policy perspectives too. There are a number of policies we need to be implementing, things we need to be doing in the state that don't cost as a lot of money. Changing the way we talk about mental illness and addiction disorders. We've taken some steps on that in the past, and those are positive. We've changed language and statute. We've done other kinds of things. But simply owning how we talk about things, owning how we look at things moving forward, those can be significant when leadership takes those steps forward. We've taken some terrific steps over the past year or so towards adding some dollars back into the behavioral health funding. We need to move forward on those investments. We need to use those investments now and take them the next step. They got us closer to where we were in about 2008, but only about halfway there, and the levels for mental health services and addiction services in 2008 were woefully inadequate then.
For more about the Center for Community Solutions or their publications, please visit www.communitysolutions.com.